Good evening. My name is Lorraine Sebopelo. I'm a third-year medical student from the University of Botswana, and I'll be talking about understanding the motivations, needs, and challenges faced by aspiring neurosurgeons in Africa. And this was an e-survey. So the objectives of this presentation is actually to understand the motivations, needs, and challenges of pursuing a career in neurosurgery among aspiring African neurosurgeons. So evidence has actually indicated that there is an uneven distribution of disease burden that would require neurosurgical intervention. Of the 13.8 million people in need of neurosurgical intervention, 10.7 million live in low and middle income countries, and 2 million live in Africa alone. And Africa lacks the resources to adequately manage these cases. To address this, Africa must train specialist neurosurgeons in areas that lack neurosurgeons, which have been highlighted by the World Federation of Neurosurgical Societies. So now, how was this e-survey conducted? The study was authorized by the Institutional Review Board of the Faculty of Medicine at the Campus University of Technology in the Democratic Republic of Congo. The e-survey was then designed using Google Forms and piloted among 20 students who were not interested in neurosurgery for practicality. And the feedback was then used to further improve the survey, which had 47 questions divided into 8 sections. The study was then distributed daily via social media, and the responses were visualized as Gantt charts and semi-descriptive statistics, which were also generated, and the chi-score test was also used. From the results, about 221 respondents aged about 23.5 years from 22 African states responded to the e-survey, and most represented countries were Cameroon, Kenya, Zambia, Nigeria, and the Democratic Republic of Congo. 66.1% of the respondents were male, and 84.6% were medical students, and most studied in their home country. Few respondents had participated in neurosurgery journal clubs, conferences, and research. Also, a few had a mentor. So this chart indicates the motivations for choosing neurosurgery, which were prestige, advice from a family member, and projected income. About 51% of the respondents had passion as their main motivator. This is just to mention a few. When it comes to preconceived ideas, this chart here shows that respondents felt neurosurgery was a prestigious specialty, and that the cost of training could actually hinder their pursuit. Also, a few students had role models, which is due to lack of neurosurgeons in their region. Also, they were undecided about whether neurosurgery was an unsociable profession with higher rates of burnout. When it comes to what attracted people to neurosurgery, it is a bit of both worlds, like an enigma. It is both disheartening and gratifying. Neurosurgery has a reputation for having poor patient outcomes, and this has discouraged African students from pursuing a career in neurosurgery. It is the rewarding nature of neurosurgery that motivates them to pursue a career in the field. And one of the most gratifying procedures with spectacular results is the treatment of cerebral ischemia, which is if done in time, that is. And the role of medical schools is actually to recruit, train, and support aspiring neurosurgeons. Schools that provide early exposure to neurosurgery actually facilitate the creation of student interest groups to increase their admission into residency. There is a neurosurgical workforce deficit in Africa, and women interested in neurosurgery actually face a lot of challenges. There's that lack of mentorship, limited exposure, and a barrier within the hierarchy that prevents women from obtaining upper level positions. It is only in the recent past where women started being recognized as compared to males. There are also a few reasons as to why aspiring African neurosurgeons had low interest in the WFNS training programs. Few respondents knew these training centers and might not have known that these positions were funded. Another reason could be language and the fear of cultural shock. This leaves room for future studies to investigate the reasons behind these low interest levels. And in conclusion, there's that prestige, advice, and passion which motivated most of the aspiring African neurosurgeons. Most African countries lack the neurosurgery exposure, and also aspiring neurosurgeons face a lot of challenges in their journey. Today's aspiring African neurosurgeons can only become tomorrow's neurosurgeons if they're given the resources and opportunities to make it into and through neurosurgical training. Thank you so much for your attention, and here are the references.